Here in the webinar. So I'm really excited for today. So let's get started. So good afternoon, everybody. Thanks for tuning in to today's session, Women's Health. I am Brianna McGill. I am EAP's account manager, and I am co-hosting with the lovely Alexa Hibbard. She is our extraordinary EAP counselor. And I hope you got a pen and pad, something to nibble on, because we are getting ready to get started in today's session. But first, I just want to go over some housekeeping rules. First, please use the chat, the Q&A chat. The regular messaging chat is going to be disabled today. The session is going to be recorded, and any materials that we have available, we will send out after the session. So I'm going to now pass it off to Dr. Sarah.
Yay. Hi, everyone. Thank you so much for having me. Thank you for the introduction. My name is Sarah Taramaco, and I'm one of the owners of Pinnacle Hill Chiropractic, and I am very excited to be a part of this today. We are going to be talking about women's health, myths, misconceptions, and the science behind the truth. So, like I said, my name is Sarah. I am a chiropractor. I've been in practice almost 11 years now. I am the co-owner of Pinnacle Hill Chiropractic in Brighton, New York. I own the practice with my husband. We actually met while we were in chiropractic college and opened the practice together. My specialty in practice is women's health. So I do prenatal care, postpartum care. I do a lot of pelvic health with patients, and I also treat your standard back pain. But each of the providers in our office do something a little bit different. So I'll explain a little bit about how the rest of our providers practice as well. I'm certified and trained in a number of different rehabilitation and chiropractic techniques. So one of the big ones that everybody knows is the Webster technique. So this is a chiropractic technique that is specific for pregnant patients. So it's an additional certification that I went through after I graduated from chiropractic college to just have more education and be able to treat pregnant women a little bit better. I also have an ART certification, so it's active release techniques, which is a soft tissue technique that pretty much every NFL team's chiropractor is certified in. And then I'm trained in some other things as well that are helpful for rehabilitation and low back pain, like dynamic neuromuscular stabilization and the McKenzie method. Also, seeing as we are talking about women's health, I'm also the co-founder of the Rochester Endo Collective. So about 2.5 years ago, I was diagnosed with endometriosis. And what I noticed was in our community, there wasn't a lot of support for people who were going through this chronic condition. And even with myself being in healthcare, I did find it challenging to advocate for myself and to find answers to what I was experiencing. So myself and a pelvic floor physical therapist in town, we actually decided to start the Rochester Endo Collective. So once a month, we have a support group type meeting where we invite a healthcare provider from the community to come in and talk about their specialty and how what they do can help support people who are dealing with endometriosis. So we've had pelvic floor physical therapists, personal trainers, surgeons, acupuncturists, mental health therapists, and they've all come in and presented to these people who are dealing with endometriosis. So it's a nice way for the community to learn a little bit more about something that not a lot of people talk about. So this is just a couple of pictures of our office. So like I said, Pinnacle Hill Chiropractic is owned and co-founded by myself and my business partner slash husband, Michael Penkin. We are a multidisciplinary clinic. So we have chiropractic care, massage therapy, nutrition counseling, as well as we have an infrared sauna. So we have 8 chiropractors, 4 massage therapists, and then one of our chiropractors also does nutritional work. And then our specialties are listed there. Like I said, women's health, but chiropractors and massage therapists in general can treat a vast number of different types of complaints. So we see patients with headaches, migraines, temporal mandibular joint dysfunction, sports and performance injuries. So we see elementary school, high school athletes, college athletes, some professional athletes as well, stress-related tension and pain when people get tension headaches or tightness in their shoulders, acute or chronic conditions, as well as work injuries and car accident injuries. But our approach is really what I like to talk about is we are a patient-centered office. So every new patient appointment in our office is at least an hour in length. We're talking to our patients about their past medical history, what is bringing them in, the medications that they're taking, the surgeries that they've had. And then they're also getting a full comprehensive neurological and orthopedic exam to be able to make sure that we are ruling out any red flags and that we are getting to the bottom of what is truly bringing them into our office in the first place. And then follow-up appointments tend to be at least 20 minutes in length, but sometimes could be 40 minutes. Sometimes patients need a little bit of extra time for us to listen and really tailor care to what they have going on. We do a blend of chiropractic care, rehabilitation. So we actually have a full 1,500 square foot gym in the basement, essentially, of our office. So we bring a lot of patients down there, especially as they're trying to get back into exercise after an injury or maybe after having a baby. We do a lot of soft tissue work and then lifestyle guidance as well. And that's a little bit about what we're going to talk about today. We talk to our patients about their diet. How much alcohol are they drinking? Are they a smoker? What does your exercise routine look like? How are you sleeping? All of those things play a very big role in your musculoskeletal health. So we want to make sure that we are addressing those things with our patients as well. And we co-manage our patients with a number of different providers. Big ones are going to be primary care physicians, physical therapists, OBGYNs, midwives, orthopedic surgeons, neurosurgeons. We're really trying our best to give our patients the most patient-centered approach to care that we can. So this is our chiropractic team. I'm in the top left corner, and then my husband and business partner is right beside me. But I'll kind of go through a little bit about what everybody does. So my husband was a power lifter, a bodybuilder, and a college football player. So he sees a lot of the athletes that come into our office, as well as some complex low back injuries. Dr. Tim Daly, he loves to treat a shoulder, but he is also the only provider in our office that is full body ART certified. So he loves to treat soft tissue injuries, loves to treat nerve entrapments, and he works very closely with a lot of the orthopedic surgeons and non-operative orthos in the community. Dr. James Walters actually was a professional ballet dancer before he went to chiropractic college. So he sees a lot of performing artists in the area. He works very closely with some of the ballet schools as well. So he treats a lot of lower extremity injuries as well as temporomandibular joint pain. So he also works with a lot of dentists and orthodontists in the city to work on TMJ pain as well. Rachel Stummer is also one of our other chiropractors, but she also has her master's in clinical nutrition. So she is the one in our office that does a lot of nutrition work as well. So in addition to chiropractic, she does see nutrition patients, and she also is one of our women's health providers. Dr. Kieran Villeneuve, also ART certified, also sees some pregnancy and postpartum patients, but she also is specialized and has additional training to see pediatric patients. Dr. Zach is one of our newer chiropractors in the office. He's been in practice just over a year and a half, and he sees a little bit of everybody, but he's absolutely fantastic. And then Dr. Rachel Gianni is a new addition to our office. She actually started here yesterday, and she is certified in Graston technique, which is an instrument-assisted soft tissue technique, and sees all of our workers' comp injuries as well as a number of motor vehicle accident injuries. And then this is our massage therapy team. So we have 4 massage therapists. They all specialize in deep tissue work as well as Swedish massage. They all do prenatal massage as well. So we're very grateful to be able to refer our patients back and forth to massage therapy as needed. So today we're going to talk a lot about women's health. We are going to identify 5 common myths and misconceptions in women's health. And we're going to talk a little bit about the science that debunks each of those myths. We're going to recognize how those misconceptions can impact patient care and just impact how you are able to go into a doctor's appointment or how you're able to live your life. We're going to talk a little bit about some evidence-based insights to improve that education for, let's say you are a healthcare provider for your patients, but also just when you are going to your own doctor's appointment. And the goal is to empower women with accurate information to help support their health and their well-being. If there are any questions, please let me know. I know that some people might also have questions just about chiropractic in general. So if you do, please feel free to ask. And then they will interrupt me if there's a question that comes through. But why do myths even persist in women's health? There is a big cultural stigma, so topics like menstruation, fertility, pelvic health are often considered taboo. So people aren't talking about those things. Or we've grown up in this generation where it is not common to talk about those things. So we're continuing to avoid them as we age as well. Historical bias. For years, medical research and practice care has always centered on men, leaving women's health underrepresented, especially in the research realm. Then lack of research, of course. So only in recent decades has women's health received dedicated studies, creating gaps in knowledge. It just tends to be an area that we don't have as much information in, or a lot of the symptoms that we might be experiencing maybe as young teenagers or as we get into our fertility years or as we're having children are kind of just pushed off. And those are some of the myths that we're going to talk about today. And then misinformation in general. So myths are repeated in communities, media, and even healthcare settings. And frankly, when you are looking at social media right now, there is so much inaccurate information that is being posted on social media. And it could be posted by an influencer, it could be posted by somebody, and it's their own experience that they're trying to market as fact. And that can be really detrimental to women's health in general. Some common things that come up, and not something that we're going to talk about today, is just diastasis rectus abdominis. So that abdominal separation that happens during pregnancy. At 35 weeks pregnant, 100% of women are going to have that abdominal separation. It's a completely normal variant. But the internet often tells us that you cannot exercise your core while you're pregnant. You should not do sit-ups. And that can really create a lot of fear around movement in pregnant or postpartum patients. Did we have a question, Alexa?
Yes, we do. We do. And the diastasis, that's so interesting. And I can thank my two children for that as well. Yes. So we have a question regarding TMJ, as well as this individual said they are a COVID long hauler, still recovering from shortness of breath, exercise, lost a lot of muscle tone from my inability to exercise. Do you or any of your practice colleagues work with any COVID long haulers? If they do, in what capacity? And then the second question is sort of the same with TMJ. How
Yes.
can that particular chiropractor help?
Yes. So we'll start with the TMJ question. So for TMJ complaints, this could be your mouth is locking open, your mouth is locking closed. It could be clicking, it could be pain, it could be grinding your teeth at night. You could have braces currently, and that's playing a role. So Dr. James Walters, he is the chiropractor in our office who does specialize in TMJ pain. So I would say if you have a TMJ complaint, you want to see him. And then we also have a massage therapist who has gone through additional training in order to treat TMJ complaints as well. So they co-manage patients together very well. So treatment can look very different depending on what the patient's complaint is. But sometimes you'll do some tissue work, maybe some cupping, some instrument-assisted soft tissue on the outside of the jaw. But you can also, and both Dr. James as well as Jackie, our massage therapist, they are trained to do intraoral massage. So what they'll do is they'll place a glove on their hand, and with your permission, of course, they'll do some tissue work on some of the smaller muscles that you can get to better internally, like the pterygoid muscles. It tends to be uncomfortable, but it can make a world of a difference with people who have TMJ pain. And then sometimes there's a little bit of mobilization that happens with the jaw itself. And then we're going to give you exercises as well. So there could be stretches, there could be strengthening exercises that we give you so that you can not necessarily rely on chiropractic care, but we can give you the tools that you can do at home to keep yourself feeling good. Then, when it comes to the long haul COVID question, we do see a number of patients who do have long haul COVID symptoms. Chiropractic in general isn't going to change the symptoms per se, but it can help your body just function a little bit better. So when, let's say that somebody has a chronic cough after, and they notice that there's a lot of strain in through their ribs and in through their mid back, there's a lot of mobilizations that can be done and manipulation, tissue work to help your ribs and your thoracic spine move a little bit better. So that maybe when you start to exercise, you feel like you can take a little bit of a deeper breath because you're having more function and more motion through your thorax and through your rib cage to begin with. Also, we like to be careful with our patients as we're getting back into exercise, especially after an injury or after long haul COVID, because we just want to make sure that we are developing strength in an appropriate manner. Would I suggest somebody who's noticing that they can't exercise quite as much or their muscle mass is going down to jump back into a CrossFit class? No, but are there a lot of rehabilitative things that we can do in our gym space or with resistance bands or small kettlebells, even in our treatment rooms, that can support somebody who is looking to get stronger? Absolutely. So I would say some of the providers in our office that do a little bit more with rehabilitation would be myself, my husband, Mike Penkin, Kieran Villeneuve, and then Tim Daly as well. We're all very, very well equipped to help our patients who are dealing with, we're looking for a little bit more rehabilitation in, I guess, their treatment. I hope that answered your questions.
You are probably about to get 50 more new patient phone calls. People are like so excited. And that sounds so wonderful. So we have two more questions.
Yes, of course.
One has to do, does your particular practice have a pool?
We do not. We
Okay,
do not have a pool, so we don't do any aquatic therapy here. But there's definitely people that we would be able to refer you to in the physical therapy world who
awesome.
do aquatic therapy. So in the area, Agape Physical Therapy has access to a pool, and I don't know about Lattimore, but I do know Agape does.
Awesome. And then I know you mentioned that we weren't going to talk about diastasis recti, but do you happen to have, maybe if you could even just send me or Brianna any kind of specific exercises or strategies, tools, or techniques, and then I could maybe send them to this individual. They just asked, are there certain, specific exercises that are better when they have diastasis and maybe some exercises that aren't?
Right. And I'm sure somebody else that's watching this right now has that same question, so I'll answer it quickly. Um,
I'll ask
as
too. Why
Alexis
not?
like me. So, like I said, diastasis is very common. At 35 weeks pregnant, 100% of pregnant individuals are going to have that abdominal separation. It is a completely normal variant, and it's just how our bodies have to be able to accommodate the growing baby. So, a lot of social media and old information tells us that exercise during pregnancy is dangerous and strength training during pregnancy is dangerous, or working out your core during pregnancy is dangerous and it's going to make your diastasis worse. The newest literature, the most up-to-date literature we have in the women's health realm tells us that there is not one exercise or one movement that is actually going to cause a diastasis. So there is nothing that you can do that is going to worsen it. And that is sitting up out of bed, that is going to the CrossFit gym, that is doing a sit-up. None of those things have been clinically shown in the literature to worsen or cause a diastasis. When it comes to treating a diastasis, there's a whole, it really depends. It really, really depends. If it is a very wide diastasis, sometimes it might not close all the way and a patient could require surgery. But often, most people have a diastasis that is about 2 finger widths wide. And that tends to close just as we get a little bit further postpartum and just as people continue to heal. But as you get stronger, that tissue starts to close because it gets stronger. So the best exercises are going to be the ones that are actually engaging your core. So things like dead bugs or bird dogs or bear crawls or bear holds, Palloff presses, banded work. There's so many different things that you can start with in the early postpartum period, and then getting into more loaded activities like farmer carries, deadlifts, squats, and just making sure that you're breathing appropriately is really going to be ideal. Um, I do, and I don't even think I put it in here, but I do have an Instagram page that I do, a professional one that I do post a lot of information on. So if you go to Instagram and you type in pinnaclehillchiro.sarah, that's where you're going to find my Instagram. And I'm always posting new information and literature and things about our practice. So you'll be able to find a lot of information about diastasis in there. And then also, if you go to pinnaclehillchiropractic.com, we have a blog, and there's numerous blogs that talk about diastasis and what's safe, and how telling people that certain things are not safe is just creating more fear around movement, and it makes people very nervous. So we talk all about that too. But there's tons of information on our blog on our website as well.
That's awesome.
Cool.
Thank you.
You're
Hearing
welcome.
any kind of exercise though that is called bear crawl, I don't necessarily know if I'm quite down for.
It's very challenging.
But if it helps, you know, um, we have so many questions. Is this okay to just
Yes, it's
keep
totally
asking?
fine.
Okay. So let's see. Another question we have is insurance questions. Is
Mhm.
chiropractor care covered under the university insurance?
It
And
sure is.
okay, because U of R, we have Excellus.
Yes. So our office does accept Excellus health insurance. We also accept MVP, Cigna, and Medicare. So with the university health plan, we are considered tier 2. I know that you guys have a tiered system. So we are considered tier 2, and that is because there are no chiropractors in the university system. Everybody who is a chiropractor in the community is outside of the University of Rochester URMC system. So we are considered tier 2, but our office bills directly to Excellus. You would just pay your copay or your deductible amount, and we do the verification of benefits. And if anybody has questions, our insurance and billing coordinator, Jen, takes care of all of that and will answer all of your questions.
Incredible. Again, you're going to get 50 new patient calls today. I'm not kidding. People are so excited over here. So let's see. We have another question about, do you have staff who help navigate fibromyalgia pain?
Yes, we do. So Dr. Rachel Stummer is one of our chiropractors who does a fantastic job with any of our patients who have fibromyalgia. She has a gentle touch. She's a very calming individual. And just talking about lifestyle and nutrition is something that she brings into her practice with chiropractic care. So our Dr. Rachel Stummer is very well versed in treating patients gently with fibromyalgia, but some of our massage therapists also have experience working with patients with fibro as well.
Wonderful. And that is a perfect segue into are those massage treatments covered under insurance?
No, so as far as I am aware, none of the insurance companies in our community have massage therapy coverage. However, if you have an HSA card or an FSA account, you can use those funds for massage therapy, especially if it has been recommended by a chiropractor, a physical therapist, or a medical doctor.
Well, you know so much information. This is fantastic. We have another question. Do you work with menopausal muscular skeletal pain?
Yes. Yes. So as I've been in practice, so I just turned 36, but a lot of my patients are, of course, getting a little bit older with me. So I have a lot of patients that are going through early menopause and starting to have more pelvic floor dysfunction or more low back pain or more symptoms associated with osteopenia or osteoporosis. So those are a lot of things that I'm starting to see a lot more in my office, just as my patient population is starting to get older. So yes, it is something that I am very comfortable working with.
Wonderful. And we have one more question before we can finally jump into the myths. See, I told you people were so amped up for
I'm
this.
pumped.
We
This is
haven't even
great.
started the material yet, and we're like 25 minutes in. This is phenomenal. So, do you treat geriatric and or children patients, which I think you mentioned pediatrics? briefly?
Yes. So two of our chiropractors treat pediatric patients. So Dr. Kieran and Dr. James are the ones that tend to see the majority of our pediatric patients. And then geriatric patients, we all treat geriatric patients. But our newest chiropractor, Dr. Rachel Gianni, has a special place in her heart for those geriatric patients. But all of us definitely treat people over the age of 65 and well into their 90s. So we can take care of anybody at any age.
Awesome. Wonderful. And we have, I think Brianna's answering a question somebody asked about the tier. You said you're the second tier
Yep, we're
with
tier
the
two.
tier two. Okay,
Mhm.
with the health insurance.
Yes.
Wonderful. Okay, I think we cleared everything out for now.
Cool. Okay.
Yeah. All right, let's get into the myths.
Let's roll.
Hmm.
Okay. So just in general, why is evidence-based understanding, why does it matter? So for providers, it's going to ensure clinical decisions are guided by the latest science and not outdated assumptions. It's going to improve accuracy in our diagnosis, our treatment, and our referrals, and it's going to build trust and credibility with the patients. If we are giving them evidence-based science, they are going to be happy with that. And that's going to build that trust. And then for patients, it's going to empower our patients to advocate for their health with accurate information. It's going to help reduce fear, stigma, and self-blame, and it's going to lead to better health outcomes and quality of life for the patient. So here we go. Myth number one, leaking after childbirth is normal. This is not normal. Leaking of any sort is going to be an abnormal thing. When we are talking about leaking after you have a baby, it is common, but it is not normal. Those are different things. So, the truth is that pelvic floor dysfunction is common but not normal, and there are effective treatment and rehab options to help this. So, even if you had a baby 15 years ago and you've been experiencing urinary incontinence for the last 15 years since you had a baby, that does not mean that you are hopeless. If you see a provider who is going to be able to help you and is well educated in treating conditions such as this with regard to pelvic floor dysfunction, you will notice that the leaking will get better. The science tells us that the research on pelvic floor muscle training, which is ultimately the gold standard for treatment, it has grade A level 1 evidence supporting it. And pelvic floor muscle training isn't just Kegels. So a Kegel is that pelvic floor contraction that is kind of, a nice buzzword in social media these days. But pelvic floor muscle training is not always a Kegel. It could be that contraction, but it could also be relaxation, or it could be just working on coordination in general. So that's why it's really important to see a provider who's going to be able to determine, is your pelvic floor too tight or is it not strong enough? Because the way that you're going to treat those things are different. So the takeaway is going to be making sure that you get screening. So let's say that you just recently had a baby and you're about 6 weeks postpartum. Having an appointment with me as a chiropractor who does specialize in pelvic health or a pelvic floor physical therapist is going to be very, very valuable for you early postpartum. And then there's a ton of different rehab exercises that can be beneficial for that. And then exercise is going to improve long-term outcomes. The stronger you are and the stronger your body is, the more or the better functioning your pelvic floor is going to be, which is then just going to translate into subsequent pregnancies, subsequent postpartum periods, and then into menopause as well. But yes, leaking after childbirth is not normal. And sometimes we have patients that come in who leak when they cough or sneeze or they jump rope and they haven't even had a baby. So it's very important to make sure that you are seeing a provider who is able to tell you, is your pelvic floor too strong? Is it too weak? Or is it not coordinated well? Myth number two. Oh, do we have questions? Should I stop after each myth?
Let me see. Oh, yes, we do. Um, this one kind of goes back to a previous question.
That's okay.
Doesn't have to do with the myth. Okay. This says, are you able to identify and differentiate between a fibromyalgia and menopausal muscular skeletal pain diagnosis?
It's going to depend. So we traditionally, as chiropractors, aren't the ones diagnosing fibromyalgia. That tends to be diagnosed by maybe a rheumatologist. So we can give you, I guess, the hypothesis that maybe that is what you are dealing with. When it comes to menopause related symptoms, that's going to be more in our realm, where maybe we're talking a little bit about some osteopenia, osteoporosis symptoms, some muscle weakness that could be contributing to some joint dysfunction, and then also just how hormones can affect that as well. So I would say the menopausal one, we are going to have a easier time giving you more of a definitive answer in that realm versus the fibromyalgia realm. Cool. Okay.
Yeah,
So
I think we're good.
myth number 2, strength training makes you bulky. Now, I am part of the generation where we were growing up and we were told that the way that you get fit is by eating smaller portions and doing more cardio. And when I was young, I was told that strength training can make you bulky. My husband was a professional bodybuilder, and he says that if strength training, even with light weights, could make you bulky, being a bodybuilder and a professional athlete would be much, much easier. But we know that is not the case. So the truth is, women have lower testosterone levels, making it physiologically difficult for them to really gain large muscle mass. But resistance training is going to build strength. It's going to build bone density. It's going to help with metabolic health without that unwanted bulk, unless that is something that you're looking for. There are supplements, there are certain hypertrophy-based training programs that are going to help you build bulkier, bigger muscles. But going to your standard burn boot camp, going to the Y, taking classes at Midtown are not truly going to give you that bodybuilder aesthetic. That is something that people have to work very, very hard for if that is what their goal is. So I do tell my patients that we want you to strength train, especially as you are continuing to get older. You should be strength training as a teenager. You should be strength training in your 20s. You should be strength training to get healthy before getting pregnant, continuing to strength train during pregnancy, getting back into it postpartum, and most certainly continuing to strength train as you hit menopause. Because when you are resistance training, especially as you get older, it's going to continue to build your bone density and help sustain your bone density, which is so important because we know that the hormonal changes that are happening as we age can decrease our bone density, putting us at risk for osteopenia, osteoporosis, and then possibly fractures if we fall. So weakness as we get older is also going to put us at a fall risk. So all of those things are just compounding. So resistance training is going to improve body composition. So it's going to build muscle and help burn off adipose tissue or fat. It's going to decrease the risk of osteoporosis, and it's going to support long-term metabolic health. So it's going to help with your heart health. It's also going to help with your mental health. It's going to decrease your risk of diabetes, decrease your risk of heart disease. And it's also, those benefits are extending into pregnancy, postpartum, and then into our aging populations. So instead of just walking, being able to add in resistance activities, even if it is just with a light kettlebell or a resistance band, is really going to make a big difference as you continue to get older. So ultimately, the takeaway with strength training is it does not make women bulky, it makes them resilient. So it's going to make us stronger, which is going to decrease our risk of falling, decrease our risk of fracture, and decrease our risk of having pain. It's going to build bone density. It's going to help with joint stability and metabolic health. It's going to support our body composition goals by increasing muscle definition and muscle strength by reducing fat. And it's going to enhance daily function, confidence, going to reduce your injury risk. And it plays a huge role in pregnancy, postpartum recovery, and healthy aging. Any questions after myth 2?
So we do have some questions. Let's see. Is strength training still recommended in women that may have higher testosterone levels due to health conditions?
Yes, it's not going to be bad for you at all. So even if you do have higher testosterone levels, you might notice that you might burn fat easier. You might develop strength quicker. So it's going to affect you slightly differently, but it's still going to be extremely beneficial for your heart health, for the way that your body works with glucose, and just for bone density in general as well.
Wonderful. And we just have some more questions um, about just pelvic floor dysfunction.
Okay.
Um, just kind of any more information that you could kind of provide
Yeah.
surrounding that.
So pelvic floor dysfunction is really just a broad-based term. And what pelvic floor dysfunction, we should do a pelvic floor dysfunction one. Um, so what pelvic floor dysfunction really is any symptom related to the pelvic floor. So it could be urinary incontinence, it could be fecal incontinence, it could be pain with intercourse, it could be pelvic organ prolapse, it could be a variety of different things. So it's important to see a provider that's going to be able to diagnose what you have going on, because each of those things are going to be treated in a different way. So if somebody's pelvic floor is too tense or their pelvic floor is very, very tight, symptoms that they might experience could be urinary incontinence, urinary urgency, where they feel like they have to use the bathroom all the time, constipation, pelvic pain, low back pain, hip pain, or pain with intercourse. So a lot of those things can be caused because the pelvic floor is too tense. Then, if the pelvic floor is too weak, which is going to be the other side of the spectrum, you could have symptoms like pelvic organ prolapse, where maybe your bladder, your rectum, or your uterus are descending out of their standard positions. Um, you could have urinary incontinence, you could have fecal incontinence. So there's a number of different symptoms that can be related to if you have too much tension in your pelvic floor, or if there is not enough strength in the pelvic floor. So once again, it's kind of hard to give just a blanket statement regarding pelvic floor dysfunction, but it is something that I treat in the office on a regular basis.
Awesome. Thank you.
You're welcome.
Let me see. We have another question. I have a history of lower back issues. I've recently attempted to start working out my core for the first time in years, and I threw my back out. Do you have any other resources available for lower back friendly core exercises?
Yes, there's a ton of different exercises that you can do that are going to be friendly. Anything where you're going to remain in a neutral spine will be super helpful. And frankly, I actually don't think I have. I'm trying to think if there is a blog post on our website that talks about kind of low back friendly core exercises. I don't think there is. So, whoever that is, if you send me either a message on Instagram or you can send me an email, I can definitely help you out with some friendly things that'll be beneficial.
Awesome. Oh, sorry, I'm turning on and off the camera here. Let's see. One last question. I've had right hip pain and tenderness since I gave birth 23 years ago. Is this normal? They said I was told it is bursitis. Am I pronouncing that right?
Yep.
Okay.
So bursitis can be common early postpartum, just because I don't know if you guys can actually see me, but when moms in postpartum patients are kind of sitting into their hip while holding the baby on their hip. So bursitis can kind of rear its ugly head in that case. But if it was never treated well years ago, it's not uncommon, or it doesn't surprise me that it's still lingered. So once again, I don't ever like to tell anybody, yes, pain or dysfunction or symptoms are normal, because they're not, but they can be common. So I would say seeing a provider that's going to be able to diagnose it, treat it conservatively, will be really beneficial for you. And bursitis is something that we treat in our office as chiropractors on a very regular basis.
I think we are good to go.
Cool. So myth number 3, painful periods are normal. This is one I really wanted to put in here because of my history with endometriosis. So dysmenorrhea may signal endometriosis, PCOS, or other treatable conditions. And I'm sure the majority of the people on this call have had a terrible period, maybe when they were in their early teenage years or in their 20s, and they were told that's normal. I really never had terrible periods, but my sister also has endometriosis and hers were debilitating and still are debilitating. And for years, she was told that was normal. And now at the age of 33, she is being diagnosed with stage 4 endometriosis. So this is what is really important, is being able to advocate for ourselves and saying, no, this period is 10 out of 10 pain or 8 out of 10 pain, and this is abnormal. The science is there really isn't a ton of evidence that talks a lot about this. And then diagnostic delays. So, for instance, I was diagnosed with endometriosis at 34 years old. My sister was diagnosed at 32, and treatment options are sometimes hard to get. You can stay on birth control for a number of years, and that might help with symptoms, but a lot of people have symptoms from birth control pills as well. So they really have to work closely with their provider to find the best options for them when it comes to treatment. And then the takeaway is really, we want to validate those experiences and refer early to reduce the suffering that people are experiencing. So whether you have a daughter or a young child who's experiencing painful periods, instead of maybe just saying, hey, like, use a heating pad, maybe take some Advil, it could be beneficial to go back to their OBGYN provider and say, hey, they're really having significant symptoms. And I think that we should maybe investigate that this could be something else. And I think that's really important. So having extremely painful periods is definitely not normal. And then this is one of my favorite ones. So myth number 4, exercise during pregnancy is not safe. This is not true. Exercise during pregnancy is safe and it is beneficial for mom and the baby. Prenatal exercise is linked to a reduced risk of gestational diabetes, hypertension, improved labor outcomes, and it also is going to help prevent perinatal mood disorders. So mental health disorders both during pregnancy as well as postpartum. So the more that we can get outside, the more that we can move, the better it is going to be for pregnancy. Of course, there are red flags associated with pregnancy. So if somebody is experiencing placenta previa or they have been put on bed rest, there is going to be certain stipulations or certain things that their OB provider might tell them, hey, we can't have you exercising, we can't have you doing anything high impact. So it's very important to make sure that you are talking to your OB provider about this. But when you have a completely uncomplicated pregnancy, it is safe to continue to exercise and also even start being active during pregnancy. Would I say if you haven't exercised in 10 years and you got pregnant to go to a CrossFit class right away? I would probably say no. But there's a lot of online programs that you can find now. You can talk to local physical therapists or chiropractors like myself who work with pregnant patients that can give you programs that will be very safe and beneficial for you during pregnancy. And ultimately, the takeaway is that movement is medicine. It is safe. Modified exercise supports a healthier pregnancy, a healthier postpartum recovery, and your mental health. Do we have any questions out there?
Yes, we do. Let me see. Somebody mentioned recommendations for core exercises.
During pregnancy?
I thought that we answered that one. I'm just going back to make sure that we answered all of the questions here. And then I see another question, maybe if that person who asked if we could answer that again, to maybe just elaborate a little more.
Yeah.
The
So
other, sorry.
Go ahead.
I was just going to say maybe while we wait for them to elaborate, if we do have another question then.
Oh, great. Yeah. Then let's go to the next one.
It says almost 20 years before PCOS diagnosis, I was still just starting to get treatment. worried the same might be happening with my daughter. Would it be beneficial to start her with a chiropractor care before her symptoms get worse?
Yeah, if people are experiencing pain related to PCOS, so maybe during ovulation or bad period pain, you can get adjusted and things can help with the musculoskeletal symptoms associated with menstruation and ovulation. So I have had low back pain and hip pain during my period. It's not just abdominal cramping. So chiropractic care around that area can be beneficial, especially when you do have your period or when you know it's coming or during ovulation. So she absolutely could. I would still encourage her to, or encourage you to get her in to see an OBGYN and possibly a referral to a specialist just to make sure that we're not missing anything while she's young.
Yes, wonderful. Okay. So we have received just a couple kind of comments regarding any kind of resources, if any of the attendees had any questions or concerns for their own, health or health of families. I know what this individual attendee was referring to is sending recommendations to that one individual for any kind of like core exercises or kind of, the plug for somebody to reach out to you. Would there be a particular contact person or website or resource page where people could go to receive some of this information
What
or
I could
something that
do,
we could send out?
yeah, I could do that. I could put together like I'll send you guys this presentation, but I can maybe give you, some links to some videos that are on our YouTube page and things like that if you guys would like. All of it is going to be safe. There's always a disclaimer that says, be careful if something is uncomfortable. We don't want to say that we are treating anything without doing an exam, but there's going to be, safe exercises that people can start to add in on a regular basis that are going to be safe. But yeah, I can send you guys something like that sometime before the end of the week, just that has some videos of some exercises and some things that people can do, especially if they have desk jobs and they're sitting all the time. So some like basic stretches and mobility things. I could definitely do that as like some resources and maybe put some links, some embedded links to some of the blogs that could be beneficial. I could do that
Yeah,
and make like a nice little handout for everybody.
that would be wonderful. Yes, I
Cool.
think people would love that.
Yeah.
Yes, we're getting some feedback. That would be great.
Yeah. And then
Also,
I'll put my email on that sheet too. My email, in case anybody wants it, is just dr.sarah@pinnaclehillchiropractic.com. And if you go to our website and you go to my bio page, you can click the email Dr. Sarah. And if you have any questions, you can absolutely email me, even if it's a question, about your own health or about a family member's health, and we can kind of have I'm not going to say, hey, this is what you have to do and this is what your diagnosis is, of course,
right,
via email. But if I think that you could be a good fit for my practice or for one of the patient or one of the providers here, and we'll be able to get more information by a patient appointment, I'll be able to tell you that as well.
right, absolutely. So recognizing that it's, general information and
Yes.
for a more specific, individualized,
Mhm.
level of care, they would certainly have to reach out to you to schedule an appointment with your
Yeah, we'll have
practice.
to dig a
Yeah.
little deeper.
Yeah, of course. So yes, people are just really saying that that would be awesome.
Yeah, absolutely. I can put
Yes.
together something pretty great for everybody.
Wonderful. And what Brianna and I will do for the individuals who registered for this Health Bites, we will just send out kind of a mass email
Amazing.
to all the emails who the people who registered.
Perfect.
Wonderful.
Okay, we got one more myth. It's a menopause myth. So, last myth, menopause is the end of health, vitality, and sexuality. I'm hoping that we all know that that is not true. While hormonal changes do occur, many women thrive in menopause with the correct support. The science really is that exercise, good nutrition, pelvic floor care, stress management, all is going to reduce the risk of heart disease, osteoporosis, and sexual dysfunction. So, like we kind of said, continuing to strength train, seeing a pelvic floor provider, working on your nutrition, staying healthy, staying active is all going to be beneficial through menopause. And there are a ton of incredible OBGYN providers in the city that are starting to do more work in the menopause and hormone dysfunction realm as women are starting to age. So there is some fantastic providers in the city. And if you have questions, you can definitely let me know and I can send you their information. Penfield OBGYN, they're starting to do a little bit more work with menopause patients and hormone dysfunction. So definitely reach out to them. They're fantastic. Um, And then our real big takeaway is that menopause is not the end of health. It's a natural transition that with support can be a time of renewal. With lifestyle strategies such as strength training, balanced nutrition, stress management, you can really maintain energy, strength, and vitality as you age. And then there are medical options, including hormone replacement therapy and non-hormonal therapies that can effectively manage symptoms and protect long-term health. One thing that we didn't touch on at all today really is acupuncture, and acupuncture can be incredible for patients who are experiencing symptoms as they're getting into menopause. You would have to ask my fabulous acupuncturist about the literature and the research that does support that. But I am a big believer in acupuncture, and it's something that has helped me with my endometriosis symptoms, as well as pain and headaches and migraines. So definitely something that is a non-hormonal therapy that can be helpful. But here are just some like general wellness takeaways. So movement is medicine. We want to encourage everybody on this call to move daily. That could be parking a little bit farther away from the front door of the office, taking the stairs instead of the elevator, going on at least a 10 to 15-minute walk after dinner. And then paying attention to what you're putting into your body. You want to have a balanced plate. So you want to make sure that you're having protein, healthy fats, and colorful produce. Fat is not bad. And frankly, carbohydrates are not bad either. A lot of us growing up were told that carbs are the enemy, and they are not. You do need carbohydrates in order to survive. So you can get that from high quality breads. You can get that from vegetables. You can get it from starches. So it's important to make sure that you have a balanced meal. Stress management, so breathing, mindfulness, yoga, recovery time. So if you do strength train, it's important to make sure that you are taking rest days and you are recovering as well. And then sleep is so important. You want to make sure that you're having a consistent sleep schedule and that it's restorative. If you're waking up and you're still exhausted, maybe your quality of sleep isn't great. And then pelvic health across the lifespan. So normalize screening and care on a regular basis. So if you are experiencing pain with intercourse or pelvic heaviness or urinary incontinence, seeing a pelvic floor physical therapist or coming into our office would be very helpful for you. And then I just wanted to give everybody a little, try some of this today. So posture reset. So if you're sitting at your desk all day, or maybe after this call, if you've been sitting at your desk, you want to stand up, roll your shoulders back, and take 3 deep breaths, really feeling your chest and your belly open. You can also do a hip opener. So you can sit on the edge of your chair and cross one ankle over the opposite knee, keeping your spine nice and straight, and you can lean forward and you're going to feel some of those muscles in your hip and in your glutes stretch out. You can hold that for 5 seconds, repeat it 10 times on each side, especially if you've been sitting for a long time today. Then some neck releases. So you can tip your ear towards your shoulder and take a couple deep breaths in that position. And you can do that side to side, especially if you've been sitting in front of your computer for a long period of time. And then you can even do just some mini squats to your chair. So you can stand, perform 5 to 10 slow body weight squats. It's going to help get some blood flowing to your low back and to your hips if you've been sitting for a long time. But ultimately, movement stacks throughout the day is going to equal better energy, less tension, and improved focus. So you really want to make sure that you are taking breaks from sitting throughout your day. And then women's health myths thrive when we don't talk about them. So let's keep the conversation going. We want to make sure that we are talking about these things with our children, with our coworkers, with our family members, so that as our generations continue to come, they are comfortable talking about these things as well. But thank you very much. This is my information. So this is our practice information. Our website is listed there, pinnaclehillchiropractic.com. There is tons and tons of information on our website. Please, please, please feel free to reach out to me if you have any questions. And then that QR code there goes to the link tree on our Instagram. So you'll be able to find a bunch of different links that are already on our link tree. Plus, you'll be able to follow our Instagram, our Facebook page. We have a YouTube channel. So there is plenty of information on there, but please, please, please feel free to reach out if you have any questions. I should have put my Instagram QR code on there, but my Instagram is Pinnacle Hill Chiro, CHIRO.Sarah. And I always post fun things on there about practice, but also my dog and the Buffalo Bills. So go Bills. Do we have any other questions?
Not at this moment, no.
Awesome.
But thank you so much. This was wonderful.
Awesome.
And
Oh,
thank
thank you,
you.
Brianna, for putting my little Instagram in there.
Yes, Brianna's been putting resource pages from your website
Oh,
and
great.
contact information in the chat for everybody to see as well. And then
Amazing.
yes, when you have the time, please feel free to send those resources. And like I said, Brianna and I will send them out to the attendees who registered for this Health Bites.
Perfect. I think I just sent you guys as the host my email too. So if you wanted to send that out, anybody's welcome to email me. Everything comes to my cell phone, so I'll get to you as soon as I possibly can. But yeah, if anybody has any questions, please feel free to reach out. We are all accepting new patients. We do take insurance. So if you are looking for a chiropractor for the first time or help with any of the things we've talked about today, please, please, we would love to take great care of you.
Awesome. Thank
Fantastic.
you. Thank
You're
you
very welcome.
so
I appreciate
much.
it.
Thanks so
Yes.
much, Dr. Sarah. This was great. I
Oh,
feel
I'm glad
well
you guys
informed.
enjoyed it.
There's so much that I didn't know. So thank you for sharing your
Yes.
expertise with us today.
Oh my gosh, of course. Thank you so much for having me.
Of
Yes.
course. You're welcome anytime.
Thank you.
Yes. Yes. All right. Have a good day. Thank you.
Thank you. Bye-bye.
Bye.
Bye.